All right, let's see here.
And Patrick, I do want to give the new members just a quick update, make sure so we can comply with the open records laws that when you do vote that your camera is on.
Okay.
And I will hand it over to you. It is 10 o'clock.
Beautiful. Hold on a second. Let's get the video on here. All right. Good morning, everybody. Thank you so much for today's meeting. My name is Patrick Merritt. I am the new TAC chair. So a great opportunity to be able to serve on this committee and to be a part of this. Did you want me to go ahead and have my new members to do introductions before or after quorum?
If you want to do it as you establish quorum, that way it helps me get familiar with our new members. Thank
Absolutely.
you.
Yes. So, yeah, we'll do roll call to establish quorum. Let's see who else on here. Do we have Stephanie Moore? Is she available? Stephanie is not present. Michael Hill.
Hi, Patrick. I'm present.
Good deal. Michael, would you care to give a brief introduction about yourself?
Sure, I'd be happy to. I'm Michael Hill. I'm the Vice President of Operations for Kentucky Care, located in Western Kentucky. My home base is Murray, Kentucky.
Good deal. Thank you, Michael. Dennis Fouch.
Present. Good morning. Dennis Fouch with Mount Sterling Pediatrics and Moorhead Pediatrics, COO for both, and we're rural health clinics. And happy to serve. Thank you.
Thank you, Dennis. Mr. Barry Martin.
I'm here. I think everybody kind of knows who I am. I've been around since dirt.
Thank you, Barry. Let's see here. And then
Is my video working?
Yep, you're good to go,
Okay.
Barry.
Okay.
All right, and then let's see here.
Patrick, it looks like Stephanie has joined.
Good deal. And Miss Stephanie, are you available?
I am. Good morning, Patrick.
Good morning. I know most people know who you are, Stephanie, but would you care to give a brief introduction?
Sure. I'm Stephanie Moore. I am the CEO of White House Clinics. We have clinics in Jackson, Madison, Estill, Rockcastle, and Garrett County. I'm also currently the board president for the KPCA.
Good deal. Thank you so much, Stephanie.
Sure.
And then, like I said, my name is Patrick Merritt. I'm the CEO of A+ Family Healthcare. We're an FQHC. We've been an FQHC since 2019. We do primary care, behavioral, school-based healthcare as well. And yeah, so we're members of KPCA and love being a part of this community and throughout the state of Kentucky as we try to better serve our rural areas and our underserved population. So it looks like we have a quorum. Can I get everyone to review the minutes, and if you have any questions, please discuss. And if there are no questions, I'll need a first and a second to approve the meeting minutes.
I'll make a motion and we approve the minutes. This is Barry.
Thank you, Barry.
I'll second. It's Dennis.
Thank you, Dennis. All right, old business. So I guess I will turn this over now to get an update on the wind down process.
Good morning. This is Veronica Judy Cecil, Senior Deputy Commissioner for Medicaid, and I just would like to welcome you, Patrick, and the other new members to the Primary Care TAC. We are very much looking forward to working with you all. We are here to support you, so anything that you need for your work as chair or for any of the members, don't ever hesitate to reach out. We're happy to provide that support. So thank you. I've got a presentation because this information is easier shared that way. So I am, if Aaron can make me, or Kelly can make me a host, I will share my screen.
just made you a co-host and I have stopped
Thank
sharing.
you.
You should be good to go.
Thank you. Okay. Here we go. Can you see my screen?
Yes, ma'am.
Okay. So for unwinding, just a reminder that we do have 860,000 cases that will go through a redetermination. We in Kentucky Medicaid, we do our enrollment and redeterminations at the case level. Generally, that's a head of household and household members. So if the household is generally eligible, then the members of the household are eligible. So we do cases. We do have over 1.7 million members in Kentucky Medicaid as of this month, but 860 cases that we're distributing over 12 months. So our first individuals that were up for renewal are those with a May 31st, 2023 end date. By end date, I mean if they do not complete redetermination by May 31st, then they are subject to disenrollment and will lose coverage starting June 1. So here's the base. This is the baseline report we filed with CMS. They have a couple of metrics that they are requiring all states to file this report. It just gives CMS, we've got some background noise.
We do.
If-
Yep. Sorry. Who is that?
if you all could mute, please. So the baseline we filed with CMS on April 8th indicated our current enrollment, which, as I mentioned, is a little over 1.7 million. Another metric they're going to be tracking is how many pending applications we have. As of the end of March, we had 2,438 pending applications. Obviously, the majority of that is new applications. And then how many hearings are pending and over 90 days. And as of the end of March, we had 575 hearings pending. On the 8th of every month, so in 4 days, we'll file a new report. So every month during the unwinding by the 8th, we're supposed to submit to CMS an updated report. That report will again track the state's progress with the redeterminations. How many we had in May, how many were we able to renew, how many are being discontinued, how many are being transferred over to the marketplace exchange so that someone who's no longer eligible for Medicaid due to over income could pick a plan on the marketplace. Connect is Kentucky's state-based marketplace. So individuals who lose Medicaid eligibility could continue coverage through that qualified health plan. So for May, and I mentioned we have cases. So in May, the number of cases that we had subject to renewal was 429. So almost 72,500 cases. Of those, we then kind of split the cases into what we call passive and active. A passive case is a case where we can go out and ping the federal hub, which has a bunch of databases in it. So it has IRS income information, it has immigration information. So lots of databases out there where we can go out and try to verify somebody's eligibility, what we call passively. So we did have a little under 50,000 cases that we could classify as passive because they do qualify for the cases that can go out and ping the federal hub. If they're not a passive case, we call them an active case. And we call it active because we know from the beginning that we're going to have to send something to them and they're going to have to take action on it. Those are generally individuals where their eligibility has some type of income or resource test. Long-term care is a good example of that. So to qualify for long-term care, we generally look at their assets to ensure that they meet eligibility. So those are active cases. We had a little under 23,000 active cases. So when I talked about we go out to the federal hub on the passive cases, if we can verify everything, then the person's done. we complete their redetermination. They don't have to send us anything. We are able to what we call renew or redetermine them, and they will get then their coverage extended for another 12 months. So for example, May 31st, 2023 individuals, if we were able to go out and passively renew them, their coverage will be extended to May 31st, 2024. We were able to passively renew 60% of those cases. I will say this is a little lower than what Kentucky generally experiences, but not completely unexpected in the fact that we're restarting. It's been 3 years for most of these individuals, and we likely do need some updated verification or information. So then for the active renewals, so individuals that we sent a renewal packet or request for information to, we have, as of April 30th, completed 1,754 of those active renewals. Of those, a little over 1,200, we were able to determine eligible for Medicaid. So again, they've been renewed and their coverage will be extended for another 12 months. We determined 160 of them are over the Medicaid federal poverty level based on income, but they qualify to move over to the exchange and for advanced premium tax credits. APTC is a tax credit that helps pay that premium and sometimes makes that plan premium either zero or low cost. So we did transition 160 cases over to the marketplace exchange so that those individuals could choose a health plan. We're really doing a lot of outreach to these folks because we don't want to break in coverage. They lose their Medicaid eligibility on May 31st. What we want to make sure is their health plan, their qualified health plan coverage starts June 1st. So they don't, lose access to services, and certainly providers don't lose reimbursement for those covered services. And then as part of that, we did have to determine 547 ineligible. So these are individuals that we are not showing as having the income to qualify for a QHP APTC. So it doesn't mean these individuals won't have coverage. Some of them may already have access to employer coverage. Some of these individuals are in the bucket of being 65 years or older, and meaning they need to go out and apply for Medicare. If that's the case, we are providing support to these individuals to understand and ensure that they have coverage after May 31st. So there's no gap. I mentioned we're doing lots of outreach to individuals. So we mailed those notices to the active renewals. We also sent out just under 20,000 requests for information for the passive renewals. We decided to do that instead of immediately terminating them because we couldn't verify something. Again, restarting this for everybody, we wanted to give people that opportunity to provide information before we disenrolled them. So we did send out more requests for information than we would normally do. When we started the process for the redeterminations for the May renewals, we did send out almost 50,000 email messages to everyone that has a May renewal. This is something we're doing for every month of renewals. So for example, anyone who has a June renewal, we've already sent out an email to them to say, hey, your renewal date is June 30th. And the same thing for July and August as we go through the unwinding period through April. They'll get this email about 90 days prior to their end date. And the reason we're doing this is just because they don't know what their renewal date is. We haven't had to have a renewal date for 3 years. So we're just making sure people understand we're restarting this. You've got a renewal date. This is your renewal date. We also, our contact center, we brought on a bunch of folks to help us, support us. But our contact center is calling every single household that has an active renewal. So every household that's gotten a renewal packet or request for information is getting a call from us. And that's what those alert calls you see on this slide are. We made 8,800 alert calls. Those are calls we made and we're actually able to reach somebody. And then about a similar number of calls that we made for those active renewals, we left a message. You see on here, we also have what we call nudges. So a nudge is where we go and just contact somebody if we haven't received anything, or if they did respond and sent us something, but we still need something else. We also called them back and nudged them to provide that information. So as part of that process, a little over 4,400 calls we made to individuals that sent us information, but we still needed something else. And we were able to complete that and update the information so we can make that redetermination. And then almost 14,000 calls were made and left with people we haven't heard from. We're a little concerned about the fact that we have a large number of active renewals that have not responded, but they've only had the notice for about 2 weeks. So now is the time we'll probably start seeing a lot of those come in. And as their end of the month approaches for the May renewals, we will continue to outreach to those folks again on the 15th of the month, just to make sure they understand that there was action they needed to take. Now, it's very possible they're no longer eligible and they know it. And that's why they've not taken action. But we're going to keep reminding them that that date's approaching and to please take action if you are eligible. The other thing I want to mention is that if somebody loses coverage, Medicaid coverage, because they didn't respond to one of our notices, they have 90 days after their end date to submit the information or provide the verification. And if determined eligible, we will reinstate them back to their end date so that there's no gap in coverage. This is important for providers to understand, and I'm going to go through how you all might be able to help us. But one of the big reasons is that if somebody comes into your office and they were just disenrolled from Medicaid due to not responding to a notice, you all can maybe help them understand that because right now we can't reimburse for their services, but if they can get that into us, we could reinstate them for 90 days. This is permitted during the unwinding, so you'll see this across the 12 months. So I was talking about how can providers help us, and this is where we're really out there trying to talk to as many provider associations and present at conferences as much as possible. And I appreciated the opportunity to speak to the Kentucky Primary Association at their conference last month. So we added a redetermination date to Kentucky HealthNet. So as providers, when you go in to verify somebody's eligibility, that redetermination date is in red now on that member panel. That date should be a future date. And so, for example, if somebody had a May renewal, their date would have been May 31st, 2023. But if they were able to be passively renewed, or if we've been able to renew their active renewal by now, and you went in and checked, that date will now show May 31st, 2024. That's how you know somebody has been gone through a redetermination and their coverage has been extended, is when you see that additional 12 months added to their redetermination date. Kentucky HealthNet's not perfect. If you see an old date or no date, those are individuals that have what we call categorically or are categorically eligible. So the reason they have Medicaid coverage is because of some category they fall into. For example, we extended 12 months postpartum coverage to pregnant women. If they're outside of that, or while they're in that 12-month postpartum period, you probably are not going to see a redetermination date for them, or you may see an old date in there. Same for foster kids, former foster children up to age 26. So these are all categories of eligibility where somebody's is able to be in Medicaid because of that category. So again, as you all are treating Medicaid members, I know we're asking a lot of you, but it's a good opportunity to stop and check that date for them and let them know about it. Been 3 years. Some of them have never. We have new members that have never gone through a redetermination. So being able to try to help with that and get as much information out there and support for those members going through that is I think the best way to make sure that we don't see gaps in coverage and this is about members who are still eligible. So check Kentucky Health Net, and then connect those patients to either our Connect hotline or DCBS hotline, to a connector or an insurance agent. They're across the state who can help that member file that necessary information to provide for us to make that redetermination. So that's what we're asking of providers. Want to note that and remind everyone that the public health emergency is ending on May 11th. So that means several flexibilities are ending. Some we've been able to extend, and others we've put permanently into place, like our telehealth regulation. During the public health emergency, we were able to expand telehealth, and now that is incorporated into our regulation. So it goes beyond the public health emergency. One thing I really want to note for providers, and we do have a flexibility tracker on our website or on our Unwinding website. It's several pages long. It talks about every flexibility that Kentucky Medicaid put into place and whether or not we're able to extend it, or we're going to have to end it, or we've been able to put it permanently into place. Two things I want to note. One is the Office of Civil Rights just recently announced that the use of HIPAA compliant platforms for telehealth is going away on August 9th. So if you're using, as a provider, if you're using a non-HIPAA compliant platform to perform telehealth, after that date, they will start enforcing the requirement of a HIPAA compliant platform. My understanding is that a lot of the platforms like FaceTime, they're trying to find a way to get into compliance so that, and because they know it's a tool that has been used throughout the public health emergency. But just as you're evaluating the end of the public health emergency, make sure you're checking to see if you are utilizing HIPAA compliant platforms. The other thing I want to mention is during the public health emergency, we suspended provider revalidations. Some providers continued to do their revalidation, but if your due date was during the public health emergency, on May 11th, we are going to take all those providers that had a revalidation date during those 3 years, and we're going to reallocate them over the next 18 months. CMS has given states 18 months to complete those revalidations, which means that providers have 18 months to get into compliance. So on May 12th, so you could go in and check when your revalidation date is right now. If it did fall within that PHE period from March of 2020 to March 2023, after May 11th, so on May 12th, you could go in and see what your new revalidation date is. Let me say that you could do your validation today. You do not have to wait for that date to be redistributed. And in fact, we're encouraging providers to go ahead and do that. We do know that there are some providers with a lot of revalidations to complete. So we're trying to work with providers. If you're in that situation, reach out to provider enrollment. We're happy to work with you on spreading those out across the 18-month period. But in the end, we all have to be done and current as of 18 months from now. And then just a reminder, our website is pretty robust, lots of information. All of our stakeholder presentations have been recorded and added to that. We've got provider resources on there. We've got 1 and 2 pagers for providers to understand what's going on with redeterminations and how can you support patients. FAQs, frequently asked questions from our different forums. So, certainly check it out if it's helpful to you. We've got communication material on there for members. So if you want to post something in your office about the redeterminations restarting, you could pull a flyer down and post that or hand it out to members so that they understand what's happening. So I believe one more. Yep. So medicaidunwinding.ky.gov is our website. For providers, I do recommend you follow one of our social platforms. You don't have to do all 3. So Facebook, Twitter, or Instagram. If you could like us or follow us, it is the way that we are trying to get information out as quickly as possible and current on what's going on with unwinding. For example, we recently were made aware of a scam. And so we posted information about the scam on our social media. So it's a good way to stay informed about what's going on. And then we are having monthly stakeholder meetings the 3rd Thursday of every month during the unwinding period at 11 a.m. Eastern time. If you can't attend that, we will record it and post it, including any questions and responses, so that at your convenience, you're able to go back and watch it. You can register for that on our Facebook page. So that is what I have for unwinding.
Thank you so much, Veronica.
You're welcome.
All right, so moving on, are there any questions about the unwinding process? Okay, good deal. So moving on to establishment of core quality indicators, uniform between all MCOs, Division of Quality and Population Health by Angie Parker.
Yes, and Patrick, we had mentioned that Angie is out today. Sure. So if we could table that till next meeting, we will make sure there is a very robust presentation on this.
Sure, not a problem.
Thank you.
Okay, moving on to update on mobile crisis response units. Do we know who will be covering that?
Let me see if, my apologies, if we have somebody on. Anybody from our behavioral health team? If I can't find you, okay. Well, so I'm happy to provide an update on that. We are looking to implement a very comprehensive mobile crisis response model. The first step in that process is we released a request for proposals for an administrative services organization to provide statewide coverage of mobile crisis. That is currently under review, and so I can't really talk about it. But once we procure that vendor, then we will be able to start talking a lot more about what that model looks like. But it really is about no wrong door for any individual who might have a behavioral health crisis need. So as you know, we have 988, similar to 911. 988 is the behavioral health crisis line. We will connect 988 to our model. So we will send out a team that is able to address whatever crisis is happening. And then we're also looking at being able to transport somebody to an appropriate setting. That does not mean the hospital. It may mean to an FQHC or RHC or to community health center. based on what the needs are. That team might be able to triage the situation and then connect the individual to an appointment, a follow-up appointment. You know, the crisis team will be able to assess the situation and determine what's the best course of treatment for the person. So we are continuing to move that down the road. It requires a state plan amendment. It does require a lot of interaction with CMS on approvals. So we're doing all that now. The proposed implementation date is October 1st of this year. So we'll continue to keep you all updated on how that's going.
That's fantastic. That's a great opportunity. And I'm sure most RHCs and FQHCs are going to really be on board with being able to help that population.
Yeah, and along with that, this is a good opportunity for me to mention, we are looking also at a triage and transport model where if an ambulance arrives on the scene and they also could potentially just triage the situation. They could transport them to a non-hospital like an FQHC or RHC. So we're working on that right now. I don't have an anticipated timeline on it yet, but it is something we're looking at that's sort of complementary to what we're doing with mobile crisis.
Fantastic. Thank you so much.
You're welcome.
So it looks like the next item on the agenda is update on community health worker reimbursement.
Yes. So got another presentation. I like presentations. Sorry. I just think it's a better way to share information. So here we go. So as you all may know, House Bill 525 passed last year during the General Assembly legislative session. It did require the department to start covering community health workers and also had a lot of prescribed requirements for the benefit that we're going to roll out, including that the community health worker has to be certified through the program that the Department for Public Health administers. So they do have to have proper certification and meet those requirements. So we do reference the qualification for a CHW will reference the Department for Public Health's requirements. Lots of activities since that legislation. We had a work group that included folks outside of the department, behavioral health, public health. It also included advocacy organizations and people representing members and providers. So lots of stakeholder engagement on that. We submitted the state plan to CMS and it has been approved. So we're happy about that. The implementation date is July 1st. So services can start to be covered and reimbursed starting July 1st. We are finalizing the state regulations, hope to have them filed by the end of this month, but they're working their way through the process. We also plan a provider letter that we're working to get out sometime in the middle of this month, and that will describe in more detail about the services that are covered, what's required to be reimbursed for that service. So be on the lookout for that sometime later this month. The covered services, so they have to be ordered by a physician, physician assistant, nurse practitioner, certified nurse midwife, and a dentist. So these are, the typical providers that generally have to order services. And they must be delivered according to a plan of care and can include health system navigation, health promotion and coaching, and health education and training. These are the codes that will be utilized for reimbursement of the services. That first one, 98960, is for just treating one patient. The next code, 61, is for treating 2 to 4 patients. 62 is for treating 5 to 8 patients. And this is just recognizing that as community health worker, generally when they're doing coaching, can sometimes do that in a class type setting. So it allows you all to be reimbursed for those all the individuals that are participating. As a result of that, the reimbursement does reduce based on the number. So 460, the proposed rate is $22.53 for that one service. That's a 15-minute code. If there are more individuals, then it does reduce down to 1088. And then of course, 5 to 8 patients is 803. These will be included in the letter that goes out. For FQHCs and RHCs, this is not eligible for the WRAP. So you'll get paid based on the rate as like a fee for service reimbursement. And that is what I have for. And of course, I'm going to share these slides with Aaron and Kelly, and they'll post them on our web on the Primary Care TAC website and send it out to the Primary Care TAC members.
Thank you so much, Veronica.
Yep.
Patrick, this is Stephanie. I have a question if I could, please.
Sure, go ahead.
Veronica, one question I have, in terms of making sure that any claims that FQHCs or RHCs submit for community health worker reimbursement, will we use the modifier similarly to the nurse visits? Is that part of the plan?
I believe that is the guidance that will be sent out for FQHCs, RHCs. Yes.
Okay, thank you.
Yes.
Yeah, good
That's
question.
what we've talked. I'm sorry, Patrick. That's what we've talked about before, was using that same modifier.
Yep.
Good deal. All right, if there's no further questions, we'll move on to new business. We've got new business from DMS. So once again, Veronica.
Yes, no slides for this, I'm sorry to say. Wanted to make you all aware of a couple of things. First of all, you may have noticed that we refiled regulations for dental, vision, and hearing, adding services for adults. We did this once already. The regulations were found deficient by the Administrative Review Regulation Review Committee, and then were incorporated into Senate Bill 65 to prevent the department from moving forward with these regulations, both the emergency and the ordinary. Senate Bill 65 did allow us to refile with changes to the regulations. And so that's what we did. We made some changes to the regulation and then refiled them. So just want to make sure providers know that those services are still coverable. There was no gap in the services that could be delivered and reimbursed. And so you all can continue to provide and providers can continue to provide those dental, vision, and hearing services for adults. There is a hearing or a meeting of the Administrative Regulation Review Committee on Tuesday next week. It's at 1 o'clock. Our emergency regulations are on the agenda. Our ordinary are not, because they are still proceeding through the required public comment process, but they do have our emergency regs. So if you're interested in the outcome of that, you might want to pay attention to it. We're asking if providers are supportive of what we're doing. If they can certainly express that, attend the meeting. You're allowed to comment on those regulations. So just wanted to make you aware of that. And we will keep providers updated on the progress of those regulations. Another regulation we recently filed is what's called continuous coverage for children. We're really excited about this. A federal law passed in December is mandating states to implement continuous coverage for children effective January 1, 2024. But Kentucky has decided to go ahead and implement it so that we can treat all children the same, regardless of when their redetermination date is during the unwinding period. If we waited till January, then only the kids going through redetermination from January to April would have access to that coverage. We decided it was important to grant
Is everyone able to hear Veronica?
No, not at this time.
I believe she's frozen.
Yeah, I can't hear.
Yeah,
This is
same here.
Leslie. I sent her a message. I'll send her a text too. While we're waiting for her, since I'm late getting on, do you want me to just give an update on the mobile crisis, which was 4C?
Yes, that would be fantastic.
Sorry, my doggies are very happy with this weather, so rolling around back behind me. So with mobile crisis, for those of you that have heard me say this in the MCO meetings maybe, or in health and welfare or any of the TACs, we currently are developing an all-inclusive model for crisis services here in Kentucky to divert from jails and hospitals and emergency rooms, and then to ensure whatever the crisis is that we're providing it with an appropriate response and an appropriate placement of that person. So for a long time, especially in rural areas, not just rural areas, but especially rural areas, we've had trouble with, police being called or EMS, not their fault. It's oftentimes been because there hasn't been other options available or limited options. So we're working on that. We've partnered with our sister agencies to develop this all-inclusive model. And I can't remember, I'll just go back just a tad, if that's okay. I can't remember the last time I spoke or that you all might have heard me speak. In December of 2022, we finished developing the models and how this would look. We're trying to fill all the gaps in Kentucky. Of course, it won't be perfect, but we are trying to fill all the gaps so we can. We've got some rural areas that we are concerned about. So in November, we applied for a HRSA grant, and it was a Rural Health Network application grant to help with co-response in the rural areas. January to March, we met with all the stakeholders related to co-response. And then in March of 2023, very proudly, the governor announced our proposal online, which was very exciting for us. We currently right now have a proposal that we will be proceeding with after the 5th, which is tomorrow, and very exciting times. And I can come back and talk to you all later if you want more information about mobile. Is there any questions that I can answer right now?
No, I think you're good, Leslie.
Okay. I see Veronica's back on too. Veronica, I stole your time while
Yes.
you're away.
No, that's okay. I'm so sorry. I don't know what happened. I had to join on my phone, so I'm not going to turn my video on. I apologize. My computer, I'm in the office, but my computer is just not wanting to work. So apologize for that.
So Veronica, I
go ahead.
completed 4C, so that's complete.
Okay. Thank you. So back to continuous coverage for children, just very quickly. It is 12 months of coverage from when they're determined eligible and or redetermined eligible. So any new enrollments into Medicaid for a child up to the age of 19 will be granted 12 months coverage. During the 12-month coverage period, the only reasons why they could lose coverage or we could end their coverage before the 12-month period is over is if they reach the age of 19, if they move out of state, if they
request that we end their coverage, and sometimes that happens if their parent qualifies for other coverage and they want to move the child over to that coverage, or of course if the child passes away. So only under those 4 situations are we allowed to end coverage prior to the 12-month period. So again, you'll see that we do have churn around, and by churn I mean we have kids drop off and come back on Medicaid because of, you know, maybe losing eligibility in one category but then coming back on in another. This will help with that churn. The kid then will be covered the entire 12 months, and then upon that end of the 12-month period, if they're determined no longer eligible, is when they would lose coverage. I think this is great for kids. It'll maintain services, very helpful, I think, to providers, because you all can continue to be reimbursed for those services. So we are happy to extend this coverage to kids. The last thing I want to mention is we do have and are monitoring a new rule RULE that CMS issued on Friday last week. It's probably one of the largest proposed federal rules I've seen in a long time. And there are 2 parts to it. One is access to services that falls under sort of fee for service. And then there's a managed care access rule. This rule, these 2 proposed rules are, there's so much in it, but I think a couple of things I want to mention to you all. One is that it does propose changes to the Medicaid Advisory Council and how states administer that council and the participants, the required participants on that council. So that's something we'll be monitoring. This is very, very early in the proposed rule process. So we're talking about something that's probably not going to happen until next year or longer, depending on what the requirement in the rule is. But we're going to keep you guys posted. Again, we're sort of still absorbing it. It's very large. And we'll continue to provide information to providers as how it may impact the Medicaid program, because there are lots of changes. And those are just a couple of things I wanted to highlight from Kentucky Medicaid.
Thank you, Veronica. Are there any questions for Veronica pertaining to the new business? All right, so we're going to move on to reports from the MCOs. United, are you present?
Good morning. Yes, I'm Dr. Canner. Thank you so much for that presentation, and learned a lot there, Veronica. Thank you. 2 things for us. I would like to, our care management team reaches out to providers trying to find member contact information. And I found it interesting that the emails are being sent. It's just something that we struggle with, connecting with members. So it really is okay for the providers to be able to give member contact information. Some providers are just not willing to share that, and I would encourage that, relaying that information if possible. And then the other point that I wanted to bring out is that we have a doula pilot that we've been doing here in Kentucky. And for those that don't know, a doula is a non-clinical support person that provides emotional, informational, physical support for women during and after labor. We've found that it can reduce preterm birth, reduce the risk of C-section, improves lactation, breastfeeding, higher APGAR scores. And if you have a member who would be interested in that, I'll put my email in the chat. Connect with me, or there are the other usual channels within our company, whether it's through NurseLine or our care management team. There are many ways, but if you do have a member who would be interested, please let us know. We're primarily targeting the Louisville, Lexington area because that's where the doulas tend to be right now, but there is virtual support. So even outside of that, there are the technology with phone and video chat is available. So I would love to see more members take advantage of that opportunity. And it's not just for high risk women, it's for anybody if they're so interested. That's it for me. Any questions?
Yeah, Dr. Cantor, this is Barry. Did you say that some of the providers are not willing to assist the MCOs with trying to reach out to the patients, giving
Yes.
information?
Yes.
Okay.
Okay.
Dr. Cantor,
Yes,
Definitely.
sir.
to kind of piggyback on Barry, what is the opposition you're seeing?
Not sure that they're allowed to share that information.
Okay.
So like we wouldn't be allowed to share our information about our common patients that are with your MCO?
Correct. Like, so when we
Veronica,
are,
is there any reason we can't? I mean, it seems like the MCO, DMF, and the provider are partners. What's stopping us from having that communication?
Barry, it seems to me that even when we try to exchange information with other offices, people get like, I don't know, it's like they make their own HIPAA rules up. So maybe we need to just send a communication out to everyone clarifying that part of the contract.
I think it's a misunderstanding of the HIPAA rules.
I mean, I could understand, if there's not a release of information, swapping information from one provider to the other, but the swapping of information to DMF or the MCOs is all contractually covered. So we shouldn't have any HIPAA issues or any contractual issues there. So I really don't understand it.
This is Paula McFall with WellCare. We are also running into that situation. We're trying to outreach members who have multiple ED visits, and when we contact the EDs, we're having difficulty getting any kind of demographics to try to connect with the member.
And this is Stuart Owen with WellCare, and I was going to add, our care manager, we're currently pursuing doula services as a value-added benefit. And our care managers have told us that there are some providers who are absolutely resistant to that, to doulas. Yeah, I guess they're not clinicians. I guess they just consider them as interfering, or maybe stay in your lane. You don't belong here. But we've absolutely are hearing that some providers resist doulas, a doula being present and participating in the whole experience.
This is Veronica. We're happy to take that back and see what we can do to improve the situation.
Thank you, Veronica. So WellCare, do we have any updates from WellCare?
Hi, Patrick. This is John Akers with WellCare. One update, our 2023 provider summits are this month, and we're going to be in Louisville at the U of L Shelby campus. We'll be in Owensboro at the Owensboro Convention Center, in Lexington at Embassy Suites, and in Prestonsburg at beautiful Jenny Wally State Park. So more details, the agenda, registration information is out on our public website. There is a WellCare of Kentucky 2023 Provider Summit link. It's got a flyer, it's got the agenda, and it's got registration information there. So love to see anybody and everybody at these summits. Thank you so much.
Thank you, John. Okay, we're moving on to Humana. Is there any updates?
Hey, yeah, Sarah Moyer here. I have just a couple slides if I could share. If not, I will talk through and send it to you guys later. It looks like I don't have sharing. But just first, great presentation today. Thank you, Veronica.
Sarah,
But-
I
yeah.
just made you a co-host. You should be able to share now. You're welcome.
But just want to emphasize that we are also working really hard on public health emergency unwinding, outreaching to our members, making sure that they stay connected to their insurance and access to care, really important. So thank you for working with us on that, both the state and our primary care physicians. All of our utilization management, care management, all working on trying just to make sure everyone stays access to care. Transportation has consistently come up in our member meetings. And so just want to highlight a few things that we are doing with transportation, using the NEMT, like everyone, just trying to get members connected to their visits and anything they might need for transportation. Also, our SCOH coordinators work with members who have transportation concerns, helping them find local resources. So please make sure you're using us as an asset for your members. If they're having trouble accessing any sort of appointments, call us. We can help them get connected. We'll work with them on ways. We've got our Go 365 incentive card, so they're getting gift cards for going to the visits, working with them to try to use that for gas or anything else they might need to get there. We also have a workforce development program. So those members that are engaged in that get transportation access to be able to have transportation to get to that program. And then we've got a pilot going with 7 counties in Jefferson County where they get a TAC card as well. And so just it's something on the forefront of our mind because we know that's an issue for you all and our members. We also, just a reminder that we have our provider relations, any claims issues, this is the email, our provider relations inbox that is there as well too, and a link to all of our resources for you. And then finally, it's being slow to switch screens, but links to all of our provider manuals and any sort of link you need for the website. So just putting that reminder out there as well. That was it for what I wanted to present, but happy to answer any questions that you guys are having. We also have a doula pilot. Just want to add on to what others are saying, not a pilot. We reimburse doulas directly. We had been doing it through claims. We know that that was a barrier for some of the doulas across the state, and so we're switching to an invoicing program. So hopefully that will help get their doulas reimbursed and more members using them. But every member can find their own doula, whoever it is, and then we reimburse the doula directly. So if you have someone interested, just tell them they can, if they need help finding one, our care management program for maternity can help them with that as well.
Thank you, Sarah. Okay, we're going to move on to Passport by Melina. If there are any updates.
Yes, this is Becky Murphy, covering, I think, for Yolanda, who normally attends. Just a few updates this month. We did transition to a new dental care administrator May 1st. So now we are using DentaQuest. They are working still on transitioning all the contracts. Any providers that are non-participating providers will be covered still for 90 days. And then after that, they would either need to join the network or the claims will be denied. But we are working on the transition now. It seems to be going rather smooth for the first week, which, there's always some bumps in the road, but so far we have not had, too many problems with it. So move on to the next update. So I'm reading my notes here. We are working for the Passport Advantage providers. We are working on our model of care training. It's now available on our website. And all providers are required by CMS to complete the model of care training for each of the MCOs they participate with. So if you will go on to the website and there's a link there to do the training and then complete the attestation and send it in to us. We will be able to track that and report it out. We do have new HEDIS tip sheets for 2023. They're available on our Availity portal. They do reflect the changes for 2023. There are some new HEDIS measures for, it's about 6 different categories. So if you all want access to those, you'll know what the new HEDIS changes are. Those are available. We are encouraging providers to attend the DMS forums. We have 2 this week and 1 next week. And so if you have not attended any of those, please try to make an effort to. They're very good. The Availity Essentials training is available. We're having 2 trainings in May and 2 in June, on May 9th and May 25th. And then again on June 7th and June 23rd. And if you want interested in any of those, we're encouraging providers. We're reaching out to providers, or you can contact your rep and we'll get you the information. I can also share this slide deck with anybody that wants it afterwards. It's the one that we always share with the providers in our monthly JOC meetings or any of the meetings that we have. We also are partnering with our members for the redetermination right now. Our growth and community engagement team is outreaching to members and community-based organizations. We're hosting monthly community-based meetings at our one-stop help center. We're doing emails, we're doing phone calls. So we're also trying to help support the redetermination for the members. So any questions? All right, thank you.
Thank you, Becky. All right, we're going to move on to Anthem for any updates.
Thanks, Patrick. Brian Richardson with Anthem. Good morning, everybody. Thank you all for having us. Had a couple links that I wanted to share with everyone. If I could share my screen and do that. It says I'm disabled right now.
You should now be a co-host.
Okay, thanks. I've lost my my share button. I'm sorry for that. I've lost my share button on it. There it is. It came back. It literally popped up. Is it coming up, guys?
Yes, sir.
Great. Well, now I can't see it on my end. Which one is it, Patrick? I'm sorry. I have 2 of them.
No, you're good. It's the provider education webinars.
Okay, thank you. This is different webinars that we're offering through the month of, well, we've had a few already, but through April and May and June. So I wanted to share that with everybody that's coming up, anybody that would like to log on. And as what I'll do, I'll take this link and the other one that I have, and I'll put it in the chat so that anybody can log on to those if they like. And the second one we wanted to bring up. Can you see the resources to support diverse patient panel?
No, it's not. It's not
Let's
coming
do
through.
a new share then. Here we go. There it is. And this is a patient panel that we have. It's another link that I'm going to share with you guys. And looking through it, it's some information for different diverse areas that we offer. And one part that I actually noticed in there, living with a registered nurse, it has some free MCEs that are on there yearly. So that's a nice offer that we have. But like I said, I'll share this with the guys in the link. And also we have one more person, Stuart Cox, my colleague, that would like to jump on and share something else with you all. Thanks for having me.
Hi there, it's Stuart Cox. If I could have a share permission, please.
Give me just a second.
Sure.
Can you do me a quick favor and turn your camera off? For some reason, when the camera's on, I can't find the options for each person. Thank you.
No problem. I'm Stuart Cox, by the way, the Director of Clinical Quality Programs for the Anthem Medicaid Kentucky plan. And what we'll be sharing here is we have a new update to our member Healthy Rewards incentives. And the provider will be, the provider bulletin flyer will be posted on our portal very shortly, but I wanted to just show that and hit a couple of highlights of some things that are new there that we might be able to use your help with in promoting with patients for awareness on healthy rewards incentives.
There you go. That should have worked now. Sorry about the delay on that.
Okay, no problem. If you can let me know as soon as you can see my display.
Yes, sir. You're good to go.
Okay. So obviously healthy rewards important for, we've seen this year actually and last year increases in the enrollment and utilization of the healthy rewards. And two areas that we've really tried to, all the MCOs, we all have an opportunity to get members in, patients into the providers, particularly to help work on, for wellness visits, particularly to help work on screening for cancer, preventive related measure, gap closure, but also for immunizations with children particularly, and then like the weight assessments and the nutrition and physical counseling, physical activity counseling. And those are going to be more important even coming up in the next year or so. But what we've done on our healthy rewards is we've actually, we've got grouped here together first our adult well visits and our child and adolescent well visits. And we've done some optimization on some of our rates. But importantly, we tried to also, we've heard some feedback from the dental providers, a lot of concern about what they're seeing with children coming in, either probably between the COVID period and with parents hesitant to come in and bring kids in. But a lot of issues with dental requiring escalated care beyond just the basic screening elements. And of course, we do have a couple a new measure there around the OED, which is the oral exam for dental that replaces the old ADV measure for HEDIS. But particularly, there's a new topical fluoride treatment measure there. So we just thought we would ask where possible for physicians to help refer members to get their kids in addition to a dental incentive we provide. We've also added an adult dental incentive. There's no HEDIS measure for that, but we feel it's important overall, the combination of dental care with good preventive and screening care as well. So we wanted to point that out first, that's an area that we're focusing on and we think could be helpful. Obviously, our cancer screening measures next down are listed here. The HPV vaccination for kids along with flu. The flu, of course, helps with that CIS combo 10 measure and the HPV vaccination for the IMA combo 2 for adolescents. So again, screening, prevention, vaccinations are critical areas that can use some referral there. And then in addition, on the second page here, just our other chronic conditions listed there. We've added actually a suicide prevention quiz. We wanted to make sure that we tie in as members enroll in healthy rewards that that we have some screening there and an opportunity to capture some data and get them referred appropriately. This will be posted. We have the reference information, how to refer members where to go if they need help with enrollment or to getting connected. There's a QR code on here as well, so they can you can easily snap that and help make the referral that way. Any questions?
Does the member have to have a smartphone? Oh, I'm sorry.
Actually, a member can enroll through, on the computer, going to a web address if they can go, so you can technically do it from multiple locations. It doesn't have to be from a smartphone. If somebody does have a challenge though, calling the actual, either the healthy reward number or calling into our Anthem, care customer service, someone can help them do that. Or actually, as we go out and do community events or we do clinic day events or anything like that, we've actually got our folks that are helping manually enroll patients at those locations on site there. So we've got some alternates to help with that.
Is there a reason why they have to enroll and it's not just done automatically? Or,
That's something we're looking at for the future, but that's how the process has been set up and established, and we're looking at that opportunity. There are some things, some complications around that we've learned about, but for the future, that is something we're trying to look at a possibility. Could we offer that automatic enrollment some way? However, there are some things through the enrollment process. It does make sure that HRAs, that's an option there to complete that. When we're with our new member orientation sessions, that's a whole discussion point that we have with members at that point as well, the importance of enrolling and some of the things that they can do. Of course, with Healthy Rewards, with any of these member incentives, if members start to think about it, they can stack these and you can combine. So there's quite a bit of incentive opportunity available there as you can combine these. So it's helpful when there can be some counseling and discussion with them as they start to go through the enrollment process.
great, thank you.
Thank you very much.
Thank you so much, sir. All right, we're going to move on to Etna.
Good morning. This is Crystal with the Aetna Better Health of Kentucky. Over the last month, our PR department has been traveling across the state, attending the DMS forums and provider conferences, as well as getting out into the field more. So we've been very pleased with the turnout at these events and have enjoyed getting to meet and connect with our providers. We've also been actively working with our providers, making outreach to provide education about the redetermination and the importance of making sure members are verifying and updating their contact information. We will continue to travel the state throughout the year, and we'll be attending all remaining forums. And also throughout the year, we will be visiting more providers. So you may get receive a phone call from one of our team members trying to schedule a date to come out and just drop in, give some information or provide training, anything that we can do to assist. We're also encouraging all providers to attend the upcoming forums in their area and hope that they will stop by our table to at least meet their PR rep, grab some educational materials, or just say hi. And that's all I have. Thank you.
Thank you guys so much for all the updates. All right, let's see here. If there's no further questions from the reports from the MCOs, we'll continue to move to if there are any recommendations to the MAC. And it looks like we do have some info. Dr. Stephen Hoagland did comment in the chat section. Apologize here. So I don't believe there are any recommendations at the moment unless someone else has anything they would like to discuss. Okay. And then Dr. Stephen Hoagland said we would reach out to get further details about the resistance to provide information pertaining to the doulas so that we can address accordingly. Dr. Stephen Hoagland, did you have any more else that you would like to discuss about that?
No, we'll follow up with each of the MCOs individually to get a little more detail there.
Thank you, Dr. Hoagland. And then it looks like we're going to be moving on to scheduling the next meeting, which is set for July 6th, 2024 is that 2024 or 2023? I'm assuming 2023.
That should be 2023. And I guess one of the things that is the week of the 4th of July. So I probably need to talk with Senior Deputy Commissioner Cecil and with the members to see if that date still will work or if we need to, if it's allowable to have an alternative.
This is Erin Bickers. I can send you some alternative dates in July, in July, and we can work on moving that if you'd like.
Well, I think that's really up to the members, obviously, but just kind of that didn't hit me until just a little bit ago. That's actually the week of the 4th. Should have.
Yeah. If you want to shoot those alternative dates out, we can look at those and talk as a committee and then get back to you.
Absolutely.
Fantastic. So is there any more topics for discussion for today's meeting?
Hey, Patrick, I want to piggyback on Dr. Hoagland's comments. I also think that the MCO should reach out to KPCA if they're having problems with our members, sharing information and working together to help our patients out, because we expect the MCOs to help us when we have problems, but we can't reach the patients. Like people that don't show up, that's on our rolls that we can't find, that's never been to our facilities. I mean, we look for the MCOs to help us out with those. So I think it should be a mutually beneficial relationship.
I greatly appreciate you saying that. Thank you.
Yeah, no, absolutely.
Yes.
Barry. That's a great, it's a great point, and I would agree with you 100%, Barry. So any way we can help the MCOs, we'd love to be able to be a part of that. All right. So, yep, we'll look for the alternative dates. If there is a change, we will send an update out accordingly. And if there's no further questions, I'll need a first and second to adjourn the meeting.
This is Stephanie. I'll move.
And I need a second.
This is Michael. I'll second.
Michael, thank you so much. All in favor, say aye.
Aye.
All right. And there's no objections. All right. Thank you guys so much for today's meeting. Thank you for the first meeting that I've had the privilege to chair this. I believe things will get a little smoother. Very anxious to be a part of this, and appreciate all the information, and we look forward to the meeting in July.
Thank you,
You
Patrick.
did a
And
fine
just so
job, Patrick.
Oh,
Yes.
you did.
Thank you all.
And just so all the new members know, after each meeting, Kelly or I will email you out all the presentations that were shown today. And with this being your all's first meeting, I'll go ahead and also send you a link to the TAC website, our YouTube channel, where we record and upload all of our meetings and just all the fun things that you guys can utilize as members.
Fantastic. Thank you so much. And I hope everyone has a blessed day.
Thank you, you too.
Thank you.
You as
Bye,
well.
guys.
Thank you.
Thanks. Bye.